We know hepatitis is in our community, but it seems to me it's really not getting the attention that it deserves, especially after looking at some of these numbers. So we want to bring in Dr. Stuart Gordon. He is with the Division of Hepatology Director, Hepatology Research over at Henry Ford Health System, and also at the Wayne State University School of Medicine. It's great to have you with us, Doctor. Thank you for your time.
Pleasure to be here. Thank you for the invitation.
I know tomorrow is World Hepatitis Day. Tell us more about that and why did it come about? Because I know this isn't the first one, but I feel like I don't remember this in years past.
It's been going on for the past few years. Thank you. It was actually designed to honor a very important person, Dr. Baruch Blumberg, who inadvertently discovered the hepatitis B virus. And so this is his birthday, and they decided to make World Hepatitis Day in honor of Dr. Blumberg. So it's an important person in our field.
So when we're talking about hepatitis, we hear about hepatitis related to like foodborne. I don't know if it's related to food or needles, but tell us more about hepatitis. How does one get hepatitis? And I know there are various versions of hepatitis, like hepatitis A versus hepatitis C. What's the difference?
Well, first off, the term itself is really sort of a generic term that refers to inflammation of the liver, right? And so it's not necessarily caused by a virus. So any cause of inflammation of the liver can be referred to as hepatitis. So whether it's a toxin like alcohol, whether it's a medication that can inflame the liver, whether it's an autoimmune process, there are various different causes of hepatitis or inflammation of the liver. And similarly, a number of different viruses can cause hepatitis, including things like Epstein-Barr and a number of other viruses. But in specific, when we refer to the term viral hepatitis, we are, as you were saying, referring to A, B, C, D, and E. And each of those has sort of a separate set of characteristics that makes it all quite very unique. So the term viral hepatitis refers to those various forms.
So as a doctor, when you're trying to treat and diagnose hepatitis, how difficult is it knowing that there are so many different parameters coming in to hepatitis?
There's actually some very sophisticated blood tests, serologic tests that can distinguish A from B, from C, et cetera. And generally when somebody will come to us with evidence of liver inflammation, there's a battery of diagnostic tests that can help us to distinguish whether we're dealing with A, B, C, et cetera.
Again, we're talking with Dr. Stuart Gordon. He is a professor of medicine at Wayne State University School of Medicine, but also the Division of the Hepatology Director and research over at Henry Ford Health System. And how does an individual know if they have hepatitis? What are the symptoms?
Well, first of all, there's acute versus chronic. And so when we use the term acute hepatitis, that's a new onset of inflammation of the liver. And it can be type A, which is foodborne, type B, type C, et cetera. But often there may be raised liver enzymes, weakness, fatigue, jaundice, nausea, et cetera. But interestingly, a lot of people may come in with hepatitis, either acute or chronic, without any symptoms at all. So it's not uncommon for people to have no symptoms at all, especially when we're talking about chronic hepatitis. So I suppose we should probably distinguish between the two.
So I know working for Henry Ford Health Systems, you study and you research hepatitis. Can you tell us about that process? Is this a team? And what do you look for?
Yeah, it's a team. Hepatitis and treatment of viral hepatitis in general has become a major interest of the pharmaceutical industry over the last several years. A number of very exciting therapies have come about to help us to treat viral hepatitis. So probably it's important to talk a little bit about the different types, type A, which is spread by foodborne usually, type B, which is very common around the world and often transmitted from mother to child at birth, maybe transmitted blood-borne sexually, type C hepatitis, which is present globally around the world, often was transmitted through non-sterile medicinal techniques around the world. Many individuals with prior drug use in years past. But we have a number of new treatments that have come about, and we're, as you say, doing a number of clinical trials looking to improve that treatment, and really such a remarkable progress over the last several years, to the point where we effectively have a cure now for hepatitis C as a result of all of these clinical trials that have gone on over the last several years.
But I think I was reading somewhere where they were saying hepatitis deaths are on the rise, HIV deaths are on the decline. What do you contribute that to? And we're talking globally here, not just in the United States.
Globally, it's a tragic situation, because many people who have this infection don't know that they are infected until they'll present with liver cancer or cirrhosis or signs of liver failure. So unfortunately, the liver is not an organ that tips its hand, and unless you really look closely to find out whether there is a liver problem or viral hepatitis, you won't know whether to treat these individuals. So all too often people will come in in the throes of liver failure or with liver cancer without ever having known that they even had this infection. So the key is to institute testing, not just here in the U.S., but around the world, because you really can't treat unless you know that you have it.
So is this hepatitis, when we're talking about hepatitis, is it treatable or is it preventable? Is there a vaccine?
Both, yes. Absolutely. For type A and type B hepatitis, there have been very safe and effective vaccines now for a number of years. These are FDA approved, well established, very safe, and we need to get these vaccines out there more widespread globally to prevent both A and B hepatitis. Type C hepatitis, there's not yet a vaccine available.
So when we're talking about the vaccine for A and B, it's so hard to even bring up the word vaccine right now with COVID-19, but we should note there are so many vaccines that have been used globally for decades. And who should get the vaccine for hepatitis A and B? Is this something we should get annually, every 5 years, and should it be everyone?
No, well, it probably should be everyone. And many years ago, they instituted neonatal hepatitis B vaccinations and A in early childhood as well. So gradually over time, the incidence of hepatitis A and B will decline as widespread vaccination catches on. These are really very safe. And hepatitis B vaccine, interestingly, was described as the first cancer vaccination to prevent cancer, because by preventing hepatitis B, we're actually preventing liver cancer, primary liver cancer. So the push is to get more people vaccinated, and especially for type A hepatitis, I think everybody should. The formal recommendations are, for travelers or for individuals who may be at high risk, but for hepatitis A, which is foodborne, we hear about these outbreaks from time to time that may be transmitted in restaurants by a food handler who may not know that they are infected. It's very easily transmitted by the foodborne oral technique. And so hepatitis A vaccination, in my opinion, should be really made available to everybody. Why subject yourself to a potentially very serious and potentially even fatal disease if it's completely preventable with a really very safe and effective vaccine?
So with that, Dr. Tu, because I'm thinking, what's treatable? Because we do know it can be fatal as well.
Yeah, hepatitis A is not really treatable. If you catch it, you have to sort of suffer through it and hope that you make your way through it. Type B hepatitis and type C hepatitis can develop into what's known as chronic infection, unlike type A. So what that means is that once the virus gets into the liver, so to speak, a sort of give and take war battle type emerges, where the immune system is sort of unable to clear the virus like it usually does with type A, for example. And it can go on to something that we refer to as chronic hepatitis. And in that type of a situation, the host, the person, doesn't really clear the virus or get rid of it, but the virus sort of sets up housekeeping and becomes a chronic infection. And those are the cases that we're interested in treatment, because we want to get rid of it or suppress it In the case of type B, we suppress the viral infection. We can't really cure it. But in the case of type C, once it's gone chronic, we actually have very safe treatments now that can result in cure. And so the goal is to get people cured, diagnosed before they go on to chronic infection, cirrhosis, liver cancer, et cetera.
Dr. Stuart Gordon with us here on the MegaCast. He is a professor of medicine at Wayne State University, but also works with the Division of Hepatology Director over at the Henry Ford Health System, and he helps with their research over there into hepatitis. And Doctor, it's been great having you. Again, anything maybe I didn't ask that you think is important for our viewers and our listeners?
I think you covered the topic. There's actually a recommendation now that every American gets tested for hepatitis C because they may not know they have it. And so for individuals born in Asia or in the Far East or in Africa or just about anywhere else outside the country, they may be at risk of hepatitis B. So it's important that if there may be a risk factor, that patients get tested, because we certainly don't want people to go on to the throes of end-stage liver disease for something that's really quite preventable and treatable. So thank you.
So with that, can I just follow up on that real quickly and ask, is this something that a patient needs to ask for when they go to their general practitioner?
Well, I think sometimes, yes. I mean, the recommendation for hepatitis C is that everyone get tested at least once. For hepatitis B, it's not really required that everybody get tested. So it does require a blood test to find out if the infection is present. So sometimes it may be worth asking. And it's not as common here in the U.S., but for individuals born just about anywhere else outside of U.S. and Europe, it's worth checking, I think. So.
Dr. Gordon with us here on the MegaCast. Wednesday, July 28th is World Hepatitis Day. If someone wants more information, where can they find it? Go to Henry Ford's website. I think if you put in hepatitis, maybe?
Sure. Yeah. Lots of good resources out there.
There really are. Even if you just Google hepatitis, World Health Day. Thank you again for your time. We so appreciate it.
Thanks you. Thanks very much.